Lord, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference, living one day at a time, enjoying one moment at a time, accepting hardships as the pathway to peace, and taking this worrisome world as it is, not as I would have it, trusting that everything will work out right if I trust in the Lord Jesus Christ.
Having the religion and the faith, I can probably approach the patient in an optimistic way and give them hope. And I found a lot of time that people who had positive attitude, they do much better. And it is sometimes helpful to have faith in God.
One thing I've learned as a survivor is that if you fight for one, you fight for them all. Because any development we can make in one cancer will have effect on other cancers. And I can't ignore that.
Cancer is something that is very personal. How is it that it is integrated into your life? It is something that you live with. How is it that you choose to live your life after this diagnosis? Is something that is up to each individual.
So Beneath the Surface is an education and advocacy project that we engaged in a couple years ago to bring to light head and neck cancer to the public. It's a cancer that doesn't get a lot of recognition just because the incidents are a little bit low. However, the devastation that brings to a patient is pretty high. So we wanted to educate the community, especially the youth, because there are certain lifestyle choices that they make when they're young that could greatly affect whether or not they get this cancer later in life. Yeah, I used to be a teacher, so I know that sometimes engaging students is difficult. You know, students are notorious for not giving a reaction or masking their reaction with another emotion like laughing or something of that nature. But what I found is a lot of times after the presentations are done, there's a lot of students that come up and thank us. There's a lot of students who want to know more information. Even during the presentations, the students are asking pretty well thought out questions, which means that they are engaged and concerned about it.
It's such a preventable cancer in so many ways that to be able to get out there and educate the youth and even the parents of the youth at this point and other healthcare providers about what they can be telling people to make smarter choices or safer choices to prevent getting this type of cancer it's so important.
The typical pattern for head and neck cancer has always been heavy drinker, heavy smoker, and the HPV has just entered the realm.
Head and neck cancer is 93% of all of head and neck cancer are caused by these three things. Those three things cause 93% of head and neck cancer. What does that say about head and neck cancer?
It's preventable.
It's preventable by 93%.
We have seen a decline in the smoking-related head and neck cancers. However, unfortunately, at the same time that there has been this decline, there's been a new cause that's been uncovered, which is the HPV, or otherwise known as the human papilloma virus. This virus has multiple strains, and a number of them have been shown to actually cause cancer. And unfortunately, head and neck cancer is one of the types of cancer that this virus can cause. There is, of course, a huge hope that by combining education and utilizing the papilloma virus vaccine, that we will see this level off and then start to decline.
So head and neck cancer in comparison to prostate cancer and breast cancer come low in incidence. It affects about 40 to 60,000 people in the US every year.
Walked into my ENT and she walked in, didn't even say hello, she said, "You have cancer." The first thing that came to mind is, how long do I have left to live? Once I had processed that, I asked the doctor, and she said, depending on how far the cancer's advanced, this is a curable cancer, but if it's gone farther than just the lymph nodes, then it might be a treatable cancer. You always have that impending feeling of doom.
Yeah.
And you're hoping for the best, but I kind of thought this could be the real deal, and it turned out to be. My wife had a nervous breakdown over this whole thing, and in 10 years that this has all happened, she's been in and out of mental institutions because she hasn't been able to deal with that. I would like to say, look, I made it. Let's go on with our lives, but unfortunately, what happened to her was part of what happened to me, and she hasn't been right since, but I love her to death, and she and I are a team, and I take care of her, and it's come to the point now where I have her at home, she's safe, but I have to do everything for her. I bathe her, I feed her, and she's not the girl that I married, but she's the girl that I love, and that's something that cancer took away from me, and I will never get back.
It affects your eating, it affects your speech, it affects your breathing even. So, and considering that the treatment of the cancer in this area becomes very tricky because it touches multiple functions that people don't quite understand, that is all being done through the larynx or the voice box and the esophagus and the back of the tongue. So that intricate anatomy makes it a difficult problem to treat.
The first couple of weeks it was tough. I lost my voice. I couldn't talk. It's hard to swallow sometimes, you know what I mean? That's the scariest part of going with the mask is swallowing. My wife feeds me through the tube and everything. So that gets a lot of vitamins in me and stuff to keep me strong, you know.
Help you?
Yeah, it's nice to.
Hey, I heard that you are doing okay.
Good, thank you,
Yeah.
Doctor. How's the images come out?
The image?
Yeah.
It keeps shrinking. From here, it is very flat, but the length up and down, it's more than 2 to 3 centimeters.
Okay.
But I think it will get there. I mean,
But thank you for everything.
oh, you're welcome.
You know, you're a good guy.
Thank you. You are a good patient.
Thank you.
Radiation and surgery are both major components of the treatment of these cancers, sometimes as complementary treatments that are given together.
Chemotherapy enhances the effectiveness of radiation, making it more powerful in a way. And what I typically tell my patients is it's sort of like a double whammy against the cancer. So you're giving them radiation, but you're adding chemotherapy, which enhances the effects of radiation. Granted, it also increases some of the side effects, but when we're treating with curative intent, with the goal of curing someone, we feel that short-term side effects are worthwhile in terms of long-term gains.
boy, when they put that mask on you, it's like you can't move, you know? It's like, I feel sorry for people that are claustrophobic and, you know, because it's scary. It's very scary. You're fighting for your life.
This is a radiation treatment mask. This is a patient. This is somebody who went through treatment. This is somebody who went through the process. I'm going to pass it around. You can feel it, touch it, see what it feels like. It represents, for a patient, probably the most difficult time in their lives. You can see it was a mask at one time, right? It used to be a mask. This starts the conversation. This brings awareness. This pushes it out there. We have a school that we've been working with that is really engaged with this project. Out of the 130 or 125 masks that were submitted completed, that school had about 30 to 35 of those masks. And so the art teacher was really engaged with the project. She had just recently experienced a couple of hardships of her own in her life when it relates to cancer.
Because I was going through it with my sister, it gave me a way to take a time in my life where I lost someone I loved dearly and make it something positive and make a difference. So in a way, I look at the masks as just another segue. The mask in the beginning is kind of plain and a kind of ugly yellow or cream color, and then we had this opportunity to make it into an amazing thing. So that shines and glows, and some of them have dark sides to them, but most of them really, in the end, what I would say, sing. I saw the kids change. Like, I'm gonna be honest with you, I had a group of kids that, you know, I mean, high schoolers are invincible. They think, you know what, there's nothing that can happen to me. And this humbled them. The support group here, the Head and Neck Cancer Support Group, had wanted to engage in a project or program that would help to bring awareness, and they had found another project where radiation therapy masks were turned into works of art and then auctioned off to help support a fund for head and neck cancer patients. When I sat down and saw the examples of some of the masks and some of the thought behind what they wanted to do, I instantly knew that this was a project that really had a life of its own.
Other than it being therapeutic and for me to not get upset about silly little things in life, it recenters you to be so grateful for what you have and to be able to think about what you can offer to other people.
I thought it was really cool how we can use the expression of art to kind of help people through their journey and help people understand what it's like.
I just wanted to make it as vibrant and uplifting as I could.
There's another family that's going through the same thing as you, and there's always hope at the end of the day for it.
I think it's really important to be a part of something that's bigger than yourself. We go through our lives every single day just worrying about little problems, and it kind of really puts it in perspective when we went to the hospital to see really that our day-to-day things are very small in the grand scheme of things. When my teacher presented the project to us, it really fueled me to put 110% into it and really do it in honor of my grandmother, and that really just inspired me to do it.
A bird sitting on a tree is not afraid of the branch breaking because her trust is not in the branch but in her own wings. Believe in yourself.
We want less customers. We don't want you through the doors. We don't want to see you in this situation. That's why we're trying to tell you about this sort of stuff. It is about the patients for sure. Overall, this whole journey is about the patients. We're trying to give something back to them for somebody who's been through so much. That's your bell. Pretty good timing.
The person from the head and neck cancer treatment come and speak to us, that pushed it to a whole nother level for me, because I have known people who have been through cancer and I've known people who passed away from it, and to be able to take what I've felt through it and what I've experienced, but then also hear people I don't even know's experiences and how I can then turn them into a positive thing was really wonderful.
A project like this, where various high schools were targeted and high school students were given information and education in this area. I mean, these kids essentially become the change agents in a way and to spread the word. So I think that is something that is so novel about this whole effort. And of course, as a parent, as a father, you know, it is really uplifting and you know, confidence inspiring for me that, you know, there is an effort in the community, essentially by a group of volunteers, you know, who are just doing this out of the goodness of their heart. This is a real deal, and that we need to improve outcomes.
So that's an example of something that
Oh my God.
changed into.
That is amazing.
Yeah.
A student did that.
The student did that, right. And there's a few more that.
Oh, I'll tell you, I wish I had saved. I have mine up in the rafters in the garage. And my wife, because of what we've gone through, said, I really wish you would get rid of that. We had no idea that this would be turned into such a, that is great.
Isn't that beautiful?
That is. That's,
Yeah.
that's amazing.
So what we did is we took them and we auctioned them off, and we raised close to $15,000 for head and neck cancer patients.
Wow.
So
That's amazing.
And
I mean,
this
that's a perfect project.
I've had 6 tumors removed in the course of 10 years of treatment. I was diagnosed at the age of 25 with a rare cancer called pheochromocytoma and paraganglioma, one of which ended up behind my ear into the brain. There's a scar that runs down the length of my side, and was a 15-hour surgery and required gamma knife radiation afterwards. And at 25, during my first surgery, they paralyzed my right vocal cord. And I've had open heart surgery to remove a tumor from the upper part of my heart. I've had 6 tumors removed. I've had 7 procedures, including gamma knife radiation. I would do everything that I did over a 10-year span of cancer treatments all over again to not have to go through what one person goes through for this. I would rather take 6 tumors in the surgeries that I had than have to go through one course of treatment for head and neck cancer.
Having cancer doesn't have to mean give up and it's all over. Having cancer can be viewed as a challenge that we face in our lives, and we have to face that challenge as we would any other. And for a lot of people, it means an experience, a growth, going through something, a growing in maturity and understanding and life experience that will allow them to come out the other end feeling like veterans of the cancer, just like somebody who's been a veteran of a war.
I just don't think that cancer is something that signals the end of your existence. It's something that each and every person needs to learn to live with, and life goes on.
Be careful with everything you do in life. Monitor it and stay away from the bad things, because you find out when you get older, it'll help you. Have a good time, but just be careful with everything. That's all. Just be careful. And you gag sometimes, you know. You go, yeah. Thank you, sir. I love you, Doctor. I love you. Thank you.
He had the cancer of the tongue, which we cannot see by looking at after he opens the mouth.
I don't wish this on anybody. Don't give up. There's always you gotta fight. You can't give in, no matter how hard it is.
I do my best to achieve cure, but without compromising the quality of life. I hope that I make the best decision for the patient. If the patient is discouraged, I hope that giving them good advice, I can turn him around and get better attitude.
And I do my best to make sure that each person sees that they're being treated as an individual. They are not a person carrying a disease, but they are a person who happens to have a disease entity. Some people are more able to deal with the fact that they have cancers than others, and some people see it as just another stumbling block in their life and they're going to deal with it and move on. And some people are devastated just by the word.
Sometimes cancer is a very scary word. Just because you have cancer doesn't mean that you're going to die today.
When I found out laryngectomy, and I was heartbroken, and I didn't know what to do. I think my first question to him was, what happens if I don't do anything? And that was not the good answer I wanted to hear.
I think so many people are terrified going through the process, and how are they ever going to have a normal life afterwards? So we have the ability to have patients like Glenn, who are great, come and show people that life doesn't end just because you have this diagnosis.
You can have a rich and rewarding life even as you integrate cancer into your life and go forward.
The first time I ever met him, like, you have a perfect stoma. When you, like, who probably ever says that, but it is, it's a perfect circle. I'm gonna start by taking out the prosthesis that's in place. Go ahead and talk for me.
Testing 1, 2, 3.
Good.
I had radiation, and then I had surgery and chemo.
Okay.
And they were,
So
the
you
radiation and the second round of treatments were several months apart.
It is what it is, and that's the greatest thing I've ever heard, because that's just where you are right now. It is what it is. Glenn is, he just inspires me, because he speaks so well, and he goes about his job, and he is just so happy all the time. You know, not happy, but he is so accepting of it.
Due to radiation, surgery, a lot of these patients have trouble with swallowing and speech, and work with myself and several of my colleagues to rehab them. To be able to give that back to somebody and help someone through that journey is very rewarding.
Most people actually can adapt remarkably well, and I'm often fascinated by some people who go into it thinking that they'll never adapt and that this is the end of everything, who a few years later might walk into my office feeling really upbeat and really normal, and even more importantly, sometimes they are just normal. And that's one of the things that people going through it find hard to believe and sometimes can't anticipate.
I say the sign of the cross every day and say my prayers and go along with life, doing the best I could. And staying positive. That's the main goal. You gotta stay positive in this world, you know?
I think every religion has given us this power of the hope.
Beneath the surface has a lot of implications of looking at somebody's face and looking what's beneath, and taking a look at the art and trying to figure out what is beneath that art that made it turn into art. That emotion brought out in a piece of art, and it shakes you. I mean, all the way down your spine, and to see it come through in the masks. They weren't just done overnight. These masks took a lot of thought and a lot of courage. It took a lot of courage for them to take and put themselves out there like that to everybody in the world, and to see their emotions through their art.
You said that you used to be an opera singer and you used to be a teacher, and now you have this job, and it's a creative job, it's an artistic job. All the masks are, art, and I was wondering, do you think that this is your way of singing?
I haven't had it described like that, but sure. I think that Oh, that one hit me between the eyes. Sure, I think that there was a switch in me at some point that said that you gotta pick yourself up and do something. There's a phrase I have tattooed on my arm that says 7 times down, 8 times up. It's an old Japanese proverb, and it just says for every time you get knocked down, you have to get back up. And if I'm going to do anything with my life, I might as well do something that I feel is worthwhile for me, worthwhile for my family, worthwhile for the community, and this job does afford me the opportunity to do so.
Some of these people have just taught me so much about life, about humanity, about what it means to be a human being.
So when I meet people in Florida or up here that are about to undergo treatment, I try to tell them that yes, this is devastating. Yes, you're going through a lot, but you will come out of it. And you will be living a life with the ones that you love. It's just a matter of willpower and never giving up.